Hello, my name is Kristen Fanning. I'm here to present my Unit 1 clinical to discuss the different types of spinal stabilizing techniques following the anterior cervical discectomy. It's simply a procedure where they do an incision in your neck and go in to remove the damaged spinal discs to avoid disturbing the spinal cord. And this is to compare the platings after the procedure. So, 11 frozen cadaver spines were thawed and compared by four groups. So, we have the intact spine, the two-level cervical fusion with standalone spacers, and the static plating, which they call CSLP, with the screws going straight into the bone, and a dynamic plating, which they call Vetra, which has rotating screws going 14 degrees both ways. The study was done to consider whether the two-level fusion with standalone spacers may reduce the motion in the spine versus an intact spine, whether the static or dynamic plating plus two-level fusion construct may improve spinal stability of the standalone spacers, and whether the plating systems may have an improved effect when comparing static versus dynamic plating. The cadaver spines were fixed to this machine that moves the cranial side to check the motions from C3 to C6 vertebrae, as well as the C7 to measure the angular motions with an optoelectronic motion measurement system. There were biaxial sensors on each vertebrae for real-time measurements and transducers under the specimen to check for compressions and other movements, and fluoroscopic imaging to monitor the motions of both the vertebrae and implants. From there, they checked for flexion, extension, lateral bending, and axial rotation. Figures 4 and 5, they compare to standalone cages and spacers versus the intact spine, and noticed significant reductions in the C4, C5 cage, but not much change once they added the C5, C6 cage. In Figure 5, the range of motion was significantly reduced after inserting the C5, C6 cage. The next set of figures compare the intact spine versus the static, the CSLP, and dynamic plates, the Vectra. The big picture is that there was a reduction in motion for all three measurements, and there wasn't much difference between the static and dynamic plates as well as the placement of the plates. Overall, we know that the spacers restricted motion and the two types of plating reduced it further and worked similarly, indicating that both the static and dynamic plating do improve spinal stability and versus the standalone spacers in a cage. Overall, the results mostly match the hypotheses, but there was not much difference between how the static and dynamic platings worked. For more accurate results, they'll need a bigger number of cadaver spines and to consider comparing some of the demographics and lifestyles like age, race, weights, diets, and gender to see if they come across anything else significant. I'm aware they did 5 men and 6 women, but they never compared gender or anything that I just mentioned, which may play a role in the flexibility of the neck movements and possibly bone density with regards to handling the plating and the screws. They also did the long-term results, so we don't know anything about the wear and the hardware to assess longevity. However, they did mention the risks of the patient developing pseudoarthrosis, simply meaning that the bone graft in this case wasn't able to fuse the vertebrae properly and that the vertebrae didn't heal, which can lead to further problems and revision surgeries down the road. Despite the slight age differences and gender differences, they treated each spine equally, even making sure they stay moist in the machine with some saline-soaked gauze. Most importantly, they used spines from cadavers, leading to realistic results. And one of the machines took real-time measurements in axial motion, making it as accurate as a live patient's neck without taking any chances on harming them. So, this is my Unit 1 clinical presentation on May 24th. I hope you enjoy it and have a lovely rest of the day. Thank you.